de taux de vaccination recommandé par l'OMS. Nous devons donc poursuivre les efforts. Pour ce faire, il convient de partager les technologies et de soutenir l'innovation afin de produire plus de vaccins au niveau local, y compris en Afrique. Et vous le savez, mesdames et messieurs, à l'instar de l'Afrique du Sud et du Rwanda, le Sénégal a pour ambition de devenir une plateforme régionale pour la production locale de vaccins. Cette ambition est soutenue par le projet Madiba et très bientôt au Sénégal, nous produirons les vaccins non seulement contre la COVID-19, contre la fièvre jaune, c'est déjà le cas, contre d'autres maladies endémiques sur le continent africain telles que la rougeole, la poliomyélite. D'ici donc la fin de l'année, nous espérons atteindre une capacité de production de 25 millions de doses par mois. À cet égard, notre réflexion devra également s'orienter vers le défi de commercialisation de ces vaccins. Une chose est de les produire, une autre chose encore beaucoup plus grande est de pouvoir les commercialiser. Le deuxième enjeu majeur que je voudrais aborder, c'est la contribution de l'Afrique au renforcement de l'architecture globale de santé. Nous le savons tous, avant d'être une affaire de science, la santé est une affaire de politique et de politique internationale. C'est la raison pour laquelle nous devons nous y prendre rapidement en nous insérant dans le système international de santé mondial. C'est un nouvel instrument qui va favoriser un meilleur accès aux vaccins et aux dispositifs médicaux. Nous devons également, et je voudrais terminer par là, nous engager dans la consolidation du règlement sanitaire international qui est en réflexion et que nous devons intégrer. Sur tous ces sujets, l'Afrique doit s'engager dans un esprit de solidarité et de coopération pour apporter sa contribution en vue de garantir un accès à des soins de santé de qualité pour tous. Pour finir, je voudrais vous assurer de la disponibilité du Sénégal à travailler avec vous sur l'ensemble de ces sujets dans un esprit de l'Afrique des solutions. L'Afrique des solutions telle que l'a déclinée hier le président Macky Sall dans son importante adresse à la communauté internationale, adresse qui a été faite au nom de notre continent, l'Afrique. Je vous remercie de votre attention. Et comme l'a dit le modérateur, I would like to apologize to all because I have to run away for another meeting right now. Thank you so much for your attention. Thank you.
Merci beaucoup, Excellence. And that's as much French as I can speak. Thank you very much, Madame, for your time today. At this juncture, ladies and gentlemen, Your Excellencies, I'd like to invite Dr. Daniel Ngamije, who is the Minister of Health of the Republic of Rwanda.
Excellencies, delegates, it is my honor to join you for a pertinent conversation on local manufacturing of vaccines, therapeutics, and diagnostics in Africa. The Africa Centers for Disease Control and Prevention, Africa CDC, and the Africa Union have called for a new public health order to safeguard the health and economic security of the continent as it strives to meet the goals of Agenda 2053. A key pillar is the local manufacture of vaccines, diagnostics, and therapeutics. Less than 1% of all vaccines used in Africa are locally produced. There are many bottlenecks on the continent, including high cost of vaccine development, low workforce availability, and slow capacity building in vaccine research and development. All these challenges and other obstacles must be addressed in a timely manner. To ensure a sustainable future for biomanufacturing in Africa, there is a need to innovate, but also to build on existing initiatives, such as the new African Medicine Agency, the Partnership for African Vaccine Manufacturing, and others. In this context, Rwanda is among countries that are preparing to initiate biomanufacturing in Africa in partnership with BioNTech and the support of various partners. Rwanda is also strengthening the national regulatory authority, Rwanda Food and Drug Authority. A sustainable future for biomanufacturing in Africa will require multidisciplinary collaborations. It will be important for governments to engage with international purchasing and distribution platforms such as UNICEF and Gavi. This will help to ensure that vaccines produced in Africa have a suitable market strategy. Similarly, we must take advantage of our local trade instruments, such as the African Continental Free Trade Area. With this, I believe that a strong and supportive foundation to biomanufacturing will be established on the continent, and vaccine equity for Africa will be assured. I thank you for your attention.
Thank you very much, Dr. Daniel Ngamije, the Health Minister of the Republic of Rwanda. At this juncture, ladies and gentlemen, I'd like to invite the Health Minister of the Federal Republic of Nigeria, Minister Etomire.
Thank you, Mr. Chairman. Ministers, ladies and gentlemen. I am speaking on behalf of His Excellency, the President of the Federal Republic of Nigeria. The topic of discussion today is absolutely current and befitting for the times. Since 2020, the COVID-19 pandemic has shaken the world with high morbidity and mortality in its wake, which tested and dented even the strongest health systems and threatened the most resilient economies. The unprecedented global response that was mounted involved and affected all sectors of national life, education, health, manufacturing, tourism, etc. System weaknesses were exposed that had suggested lack of preparedness and poor appreciation of the depth and consequences of the public health crisis. In reality, COVID-19 was altogether unique among all global infections. Although its impact is waning, it has left a mark in our consciousness that infectious diseases can be a mortal threat to humankind. It reminds also that infectious diseases do not respect borders, and that when the chips are down, all mankind is bound by one, is bound as one by a common vulnerability. I believe this awakening triggered a recognition of and a need to address global inequities in healthcare that still exist and have divided us according to our life's circumstances. Through it all, we in Africa found ourselves at the bottom of every queue for access to everything, particularly therapeutics, diagnostics, and vaccines, in what has been labeled vaccine nationalism. And despite limited capacity to help ourselves with domestic manufacturing, and also limited resources to procure at scale from open markets, we managed to survive. It also dawned on African leaders that all must be done to ensure access to critical commodities and to much better position our countries and continent for any other public health event or pandemic. Lessons learned include the need to mobilize our economic, intellectual, and other capacity to build ready and resilient sustainable systems for health nationally and continentally, with assured components for preparedness for health emergencies. But the story is not all gloomy. because in many places, African leaders of thought also rose to the occasion that we need our new public health order to be robust, resilient, and flexible to cope with any disease threats. We see the new public health order on 4 pillars. 5 pillars have been mentioned, which include resource mobilization. The first here is strengthened continental and national public health institutions and better collaboration among African countries for mutual support. Second is local manufacturing of vaccines, therapeutics, and diagnostics and commodities towards a level of self-sufficiency. The third is the attraction of training and retention of public health workforce and fostering of respectful local and international partnerships. These pillars are fundamental to securing our future and assuring our development and success of a new public health order. Much will depend on country investments across the key elements identified as the pillars to buttress the new health order. In my country, Nigeria, we are providing essential leadership and enabling environment to build the requisite capacity on all 4 pillars. And we started the journey of strengthening continental and national public health institutions. Nigeria Center for Disease Control, for example, has expanded its capacity and now has well over 80 public health laboratories with PCR capabilities from just 4 before the pandemic. Oxygen generation plants are over 120, so that at the end of this year, all localities are served. ICU and mass treatment centers are in all states. We have developed a vaccine manufacturing policy and taking steps towards capacity for domestic manufacturing of therapeutics, diagnostics, commodities, and vaccines. Nigeria is reviewing our human resource for health strategy, and also we are studying ways of changing the brain drain to brain gain by utilizing the potential of Nigerian experts in diaspora virtually or in person, in addition to attracting, training, and retaining a public health workforce that is able to multitask. We build and foster respectful local and international partnerships. We are currently taking a holistic view of the health sector through the National Health Summit that will identify immediate and current steps towards strengthening this new order. In the West African sub-region, Nigeria has collaborated closely with the West African Health Organization and also supports its commodity bulk procurement with last mile distribution, which is undertaken by the Nigerian Air Force. Nigeria fully supported the Africa CDC and the AVAT facility as a way to go in African solidarity. Considerable investment is needed to build systems, processes, structures, and institutions that will protect our people, our common interests, and provide a mechanism for Africa to effectively meet more of its needs and contribute to the global health security architecture. All hands must be on deck to accelerate action towards achieving the 2063 developmental blueprint, Agenda 2063, the Africa we want, one where no one is left behind. I thank you for your attention.
The Health Minister of Nigeria, His Excellency Tomire, thank you very much, sir. At this juncture, ladies and gentlemen, I'd like to invite Dr. Ahmed Ogwel Ouma, who is the Acting Director General of the Africa CDC.
Thank you. Thank you very much, the Director of Ceremonies. Good morning, good afternoon, good evening for those who are with us online. Your Excellency, Ambassador Mohammed Djibouti being our host of this meeting today. Thank you very much for representing your country. The Honorable Minister of Health of Rwanda, representing your head of state, the Honorable Minister of Health of Nigeria, representing the head of state, the Honorable Minister of Foreign Affairs of Senegal, also representing head of state, heads of delegations here present today, those online, partners, including private sector partners who are here today. Ladies and gentlemen, today marks a very important milestone in Africa's journey for health security. We are gathered in the sidelines of the 77th session of the UN General Assembly to share our vision for a new approach to a better health security agenda globally. I would like to congratulate all of us for being here in person and online at this very moment when Africa is making a very key contribution to the global health security architecture. The many, and there have been many, health emergencies and disease threats on the continent of Africa have taught us lessons, some very painful, and we have chosen to learn from these lessons so that we can act on them as opportunities for growth and improvement in our future actions for health security. The global health security architecture is skewed and is unfair to the continent of Africa. The global mechanisms for responding to health emergencies do not, and I repeat, do not prioritize African challenges. In fact, these global mechanisms, when confronted with the realities of African health security crisis, they work at suboptimal speed and scale. The most recent examples are the COVID-19 pandemic and the multi-country monkeypox outbreak. As Africa, we have chosen to chart a path that is best for us, a path that addresses our challenges as a priority, a path that is based on our abilities, our capacities, and capabilities. We have chosen the path of self-determination in line with Agenda 2063, the Africa that we want. Your Excellencies, ladies and gentlemen, our vision as Africa in the health security space is captured in the new public health order. This is a vision that is guided by the principle of continental ownership and leadership, equity, and investment in the whole health system. Its base is innovation and self-reliance. We as Africa have chosen to do what we need to do on our own, and we have also chosen not to do it alone. The new public health order has 5 pillars that will empower African Union member states to influence positively public health policy discourse and governance of the health security systems globally. These 5 pillars, in summary, are: 1, strengthened public health institutions to be better prepared and to act swiftly in the face of any disease threats. Africa must strengthen its continental and national level institutions for public health. And these will include the Africa CDC, the Africa Medicines Agency, as well as our national level public health institutions. The second pillar is strengthened public health workforce. This means that we need to train the right experts. We need to train them in adequate numbers And we need to provide them with the right tools so that when action is required, they are able to be deployed in the right places and in an equitable manner. The third pillar is expanded local manufacturing. Africa must secure its supply chain for all health products that are necessary for health security. We have a huge market of over 1.3 billion people. Indeed, it is a market that continues to grow. We, as Africa, must leverage on this growth so that we can be able to ensure that the manufacturing enterprise on the continent benefits from this large market. The fourth pillar is increased domestic resources. And these resources will include expertise on the continent, relevant institutions that contribute towards public health, equipment that we need, and money. We must mobilize all relevant resources locally first before we invite friends of Africa to support the gaps that we may have thereafter. Charity must truly begin at home. The fifth and final pillar is respectful and action-oriented partnerships. When we decided to walk this journey after the many painful lessons that I spoke about, we decided that we must do what is required and at the right time. We decided that we are going to work with partners who are willing to respect our priorities and support us in producing the desired results for health security on the continent of Africa. Therefore, the two characteristics of the partnerships that are captured under the new public health order are that they must be respectful of African priorities and they must be action-oriented to produce results that make Africa stronger in its health security agenda. Excellencies, ladies and gentlemen, as we discuss and reflect on Africa's journey, the lessons learned, and the way forward, all these must be embodied in the new public health order. I will therefore like to urge all of us to live the spirit of the words of His Excellency, the late President Nelson Mandela, and he said, "A winner is a dreamer who never gives up." Let me persuade you, ladies and gentlemen, that Africa is a winner, precisely because we, as dreamers of securing our own health security, are not going to give up. Let me assure all of you that the outcomes of today's milestone event is going to be our roadmap as Africa CDC, and I commit to you that we will do everything in our power, within our influence and resources, to see that your recommendations as our member state leaders on the continent are fully implemented to benefit the continent of Africa. Africa is a winner because we are dreamers who will never give up. I thank you for your attention.
And I think it deserves another round of applause for what is an obviously very powerful speech. Ladies and gentlemen, we thank you, Dr. Umar. Now, ladies and gentlemen, we'll be hearing from Dr. Rita Roy, an important partner who represents an important partner of Africa CDC. She is the president and CEO of MasterCard Foundation. We have a video message.
Your Excellencies, ladies and gentlemen, it's a pleasure to join you today. I'm very excited that you are here discussing what it will take to deliver public health. Mr. General.
Dr. Rita Roy, who represents MasterCard Foundation, President and CEO, a very, very crucial partner of Africa CDC. Let's give them a round of applause. We'd also like to recognize the presence of the CEO of NEPAD, Dr. Nardos. Thank you very much for joining us. And at this point, we do have partners in the room, and I'm wondering if, now that we have a bit of time on our hands, anybody would like to reflect on some of the things that they have had today. If you'd like to do that, please, now is the opportunity. Anybody? You're among friends, so no need to be shy. Okay. If there is nobody to speak, then I'd like to invite, oh, there is someone. Thank you.
Colleagues, hello, I'm Matthew Cavanaugh, Deputy Executive Director for UNAIDS. And we are really glad to be here in the room with several of our leaders to bring a message of solidarity with the Africa CDC, and especially alignment with this idea and the conceptualization of the new public health order. In particular, we have watched as the lessons from the HIV pandemic have not been carried forward into the COVID pandemic. We have watched far too often as the intellectual property, the know-how, and the capacity to produce vaccines has not been shared. And this is how we perpetuate pandemics. We are very worried that many of the lessons that have ensured that millions of people, 28 million people as of today around the world, who have access to antiretrovirals, that model is not being followed in the sharing of technology. And in particular, we are worried that we've only made a tiny bit of progress when it comes to ensuring that there is manufacturing capacity on the continent of Africa to ensure that the countries and governments and people of the region can be first in line, not last in line. And so we stand really strongly in solidarity with the call to action that's coming out of this meeting and lend our full support to the governments that are putting this forward and to the Africa CDC for implementing it. And we call on all global health actors to look very carefully at the proposal here to ensure that the purchase of commodities is funding the development of production capacity for people where they live on the continent now, not 5 years from now, but as soon as humanly possible. Thank you very much for inviting us.
Deputy Director of UNAIDS, thank you very much. Anybody else with thoughts? Any of the partners with anything to say? Please introduce yourself and we wait to hear your remark.
Okay, my name is Masere Keita, and I'm the Director of Programs at the African Society for Laboratory Medicine. And we've been working very closely with Africa CDC with some funding from the MasterCard Foundation to support pathogen genomics on the continent. So we just come here to lend our support for the new public health order. We will be working very closely with you in the areas of workforce development, continuing to support laboratory systems on the continent, as well as see on pathogen genomics and other initiatives. We just salute you for bringing this forward. And we are an African entity who are Africans working for Africa. So thank you very much.
Well, thank you for your remarks, and I'll let one more person say something before we continue. Okay. No more comments, thoughts? Okay, thank you very much for those remarks. At this point, I'd like to invite again Dr. Ahmed Ouma, who is the Acting Director General of Africa CDC.
No, thank you. Thank you very much, Alan. And first is to remind us that today, during this exact time, we have another very crucial event going on, the replenishment of the Global Fund, which I'm sure all of us appreciate the weight that particular process carries for the continent of Africa. And I'm going to carry out a task that will have been done by colleagues who could not be able to make it here because of that particular event. And after consultations, today's meeting, the main outcome of it is for us and to immortalize that. We have a call to action on Africa's new public health order, and with your permission, the host of this event, I will go through and read that call to action. The call to action is entitled Africa's New Public Health Order. That we, the African heads of delegations participating at the special side event health order, rejuvenating the global health security agenda, the sidelines of the 77th session of the United Nations General Assembly, mindful that Africa, a continent of more than 1.3 billion people, continues to experience the highest incidence of public health emergencies annually. Deeply concerned by the detrimental impact of the ongoing COVID-19 pandemic across Africa's health, social, and economic sectors, further concerned by the potential negative consequences of existing public health emergencies, including the multi-country monkeypox outbreak, cognizant of the challenges that African Union member states face in accessing essential medical countermeasures during the COVID-19 pandemic and other outbreaks on the continent, and driven by trade and intellectual property-related restrictions, noting the critical shortage of health workforce in Africa that is made worse by the numerous public health emergencies and challenges with securing relevant health tools for their use, recalling the African Union Assembly Decision 835 to grant autonomy to the Africa Centers for Disease Control and Prevention and upgrade the current Africa Union COVID-19 Response Fund into the Africa Epidemics Fund so as to mobilize resources for preparedness and response to disease threats on the continent. Further recalling the Africa Union Assembly Decision 735 that adopted the treaty for the establishment of the Africa Medicines Agency, recognizing the Africa Union Commission's initiative to expand Africa's manufacturing of vaccines, diagnostics, and therapeutics, and applauding the commitment, dedication, and progress demonstrated by several African Union member states in building local manufacturing capacities, appreciating the progress made by Africa CDC's Saving Lives and Livelihoods initiative in partnership with the MasterCard Foundation, creating access to COVID-19 vaccines for millions of Africans and strengthening vaccination capacity to support Africa's health security agenda. We, the heads of state and government, hereby call for the full implementation of Africa's new public health order, which includes 1, strengthened African institutions for public health. We call upon African Union member states to provide full support to African institutions for public health, including Africa CDC and the Africa Medicines Agency, in execution of their mandates. B, call upon governments, multilateral organizations, philanthropies, private sector, and civil society organizations to support institutional capacity building initiatives targeting all institutions that support public health at the continental and national levels. C, call upon the African Union Commission to expedite full operationalization of the Africa CDC and the Africa Medicines Agency. 2, strengthening public health workforce. A, we call upon governments, multilateral organizations, philanthropies, private sector, and civil society organizations to support Africa CDC's efforts and initiatives for building the capacities and capabilities of all workers who contribute to public health in Africa. And 2B, call upon African Union member states and all partners to expand and strengthen community health worker programs on the continent of Africa. Under the third pillar of expanding local manufacturing of health products, A, we call upon African Union member states to coordinate with Africa CDC and the African Union Commission as they expand manufacturing capacity and opportunities for all health products here in Africa. B, African Union member states to coordinate with Africa CDC and such as the Global Alliance for Vaccine and Immunization, Gavi, multilateral institutions, particularly those of the United Nations, philanthropies, and other stakeholders to purchase at least 30% of their vaccines from manufacturers based in Africa. E, call upon governments, multilateral organizations, philanthropies, private sector, and civil society organizations to support the removal of trade and intellectual property-related barriers to support local production of all health products in Africa. Under 4, increasing domestic investment in health, we call upon African Union member states, Africa CDC, the African Union Commission, philanthropies, and the private sector to promote innovative domestic financing mechanisms, including public-private partnerships. Finally, under 5, promoting action-oriented and respectful partnerships. A, we call upon multilateral organizations, philanthropies, private sector, civil society organizations, and all stakeholders to develop action-oriented partnership with the Africa CDC, the African Union Commission, and Africa Union member states, which are based on Africa's priorities. B, call upon African Union member states, multilateral organizations, and civil society to ensure that Africa's voice is heard and African positions on the global health security agenda are reflected in the ongoing negotiations for developing international legally binding instruments on pandemic preparedness and response. C, call upon international partners, development financing institutions, philanthropies, and the private sector to support investment in infrastructure for health manufacturing of health products in Africa through new and innovative mechanisms. And finally, D, call upon Africa CDC and the African Union Commission to strengthen scientific and technical cooperation with relevant African institutions. I submit, as this is the call to action out of this very special side event on Africa's new public health order, rejuvenating the global health security agenda. Thank you.
A very powerful and comprehensive. Thank you very much, Dr. Ouma. At this point, I'd like to invite Dr. Benjamin Judabai, who is the head of policy